So for the Duralon brand of polycarboxylate, we want to talk a little bit about ratios and mixing times. I think we mentioned that it should be mixed within 30 seconds, but this will have a powder scoop to go along with it, as I mentioned. And what you want to remember to do with this cement before you actually dispense it is to tap it on the tabletop. You want to pack that cement powder into the bottom of the jar so you get a very thick, thickly filled scoop, okay? The ratio is 1 scoop of powder to 3 drops of liquid, okay? The glass ionomer is going to be, and this particular bottle has the ratios right there, 3 scoops of powder. Now with this powder, you do want to kind of fluff it, okay, or roll it. And then you would dispense 3 of the little scoops of powder to 3 drops of the liquid. Okay? Now, for demonstration purposes, we are going to be using the polycarboxylate, okay? And if you look on your evaluation sheets on the very front page where it has the percentages, it will tell you exactly what cements to use on a typodont as well as a patient. So with this procedure, you're going to be practicing on a typodont, evaluating on one typodont, and on that typodont, you're going to be mixing and placing 2 different types of cement. You're going to be placing the polycarboxylate or the Duralon, and it's going to be on teeth number 8 and down here on tooth number 30, okay? Then you're also going to be mixing the glass ionomer, or also what we use is the Reliax, and you're going to be mixing that material and putting it on tooth number 10, right here, this lateral incisor, and tooth number 20, which is right down here, the second premolar, okay? So when you're mixing for the typodonts or for the patient, you're going to be mixing a double batch for those, okay? Just to be able to give you more cement to work with. You remember before I mentioned that, you know, these ratios are for one crown or 1 tooth. So being that you're putting these cements on 2 teeth each, okay? Polycarboxylate is on 2 teeth and glass ionomer on 2 teeth, you want to mix a double batch of each, okay? So just remember that and make sure to jot that down on your evaluation sheets. Then on the patient, once you evaluate on the typodont for those 2 types of cements, now the patient we're going to mix and place zinc phosphate cement, and we're going to place that on tooth number 8 and again tooth number 30. Okay, now the real critical thing here to remember is where to place the cement on the teeth, all right? So when we're seating a crown, the crown is hollow, right? And we fill it with cement. We don't have to really fill the whole crown with permanent cement because that crown is a custom-made crown. It's really going to fit very closely to the size of the patient's tooth. So you really only need to put the cement in and kind of paint it around the edge, the inside edge, okay? So remember, the fuller you put the cement in the crown, the more you're just going to have to remove at the end of the procedure when the cement is set, okay? So the main thing here is to remember when you seat a crown or a bridge, the material is going to kind of push out around the gingival line. Any excess that you have is going to be squeezed out around the gingiva. And it's going to be on the facial, it's going to be on the lingual, it's going to be on the mesial and distal interproximals, right? So when you're placing the cement on these teeth, make sure that you're putting it exactly in those areas, as the evaluation sheet does state. All right? Okay,